We'll kind of go through the story of how we started with an easier to use computer for seniors to get easier attachments, and how that then evolved into using technology to sort of reinforce these non-drug therapies that your staff and other people that work with dementia do all the time on their own. We are using technology to sort of help support and deliver therapy to people with dementia. There's sort of a quality of life therapy where you would be using a topic, you would be using images or music or voices from that resident's past, and then showing it to them to sort of acknowledge that you value them as a person and you're connecting with their past experiences. And so this is sort of acting, using this technology as a bridge to those long-term memories, which they cannot access on their own. Let's find out what are these other types, and how can we use technology to try to empower caregivers, empower staff, empower that family member and that resident, so that they can really get these, these richer connections and interactions with each other. And then we start to see, okay, what is the goal of this media? So we talk to the family, we talk to the staff, and we say, how can we help? Does this person need help getting up in the morning? Or are they having trouble sleeping at night? You just end up personalizing what that outcome is by resident. We try to line those up with your individual care plans that you have set up. So how can we try to reinforce the things that you're already doing as a facility?
We have a very small but powerful mission statement in that we are a Christian ministry providing exceptional services to enhance the quality of life for senior adults, and how we can be innovative and what we can do to be creative to enhance those lives. We looked at 3 objectives. We looked at how we could improve the residents' quality of life without drugs, without any type of chemical, how we could improve the health and activity, that quality of everyday life, and then support our operational best practices with this new and innovative therapy. In terms of the facility impact, the socialization is very important. Not only do we have the monitor in every room, but we have large screen monitors in our commons areas, and that's really how our residents begin to interact together. And so together they have been able to have that social interaction. It has been very stimulating. Until you see it in action, it's oftentimes difficult to describe, but just to see the value that's there and what SimpleC has really done for our organization, for those residents and for the staff and the families is phenomenal. It's been very interesting to see how the therapy grows, to help them to be able to connect not only with the staff, which makes the care events much more efficient, but also with their family and friends, so that when they come, they have a much more meaningful conversation, and the agitation is not there, so there's certainly less resistance and anxiety associated with that. So there have been positive, tangible results for our residents in just a matter of days. Positive, tangible results not only for our residents, but for their family. It's simple. SimpleC stands true to its name, but it is just so powerful in what it does to enhance the lives. I've had grandchildren come up to me and say, wow, I wish I'd had this when Grandmom first moved into Hearthstone. You think you know how things are doing, but when you hear it from families, you really know how impactful that is. First of all, our residents are happier, and that was the objective we wanted. But our staff is also happier because they feel like they're able to deliver that higher quality of care, and it really means something to them, and that they have more enjoyment in life because of this. So that has been just profound with our staff. I have sat in family meetings over the last few months. Residents' families have said, wow, I'm building my future. This can be me in a few years. But it is truly simple because it didn't take more staff time. It is certainly cost effective for us because it allows us to do more with less staff, obviously. It certainly has made us much more efficient in terms of how we give care.